Good morning, everyone. It's a great pleasure to be here. Today I'm going to be talking about our research at UCLA and the story behind it, how it led to a startup company, and I'll share you some of the technology behind this startup and also tell you more about how our research in the university led to something like this. So the central theme in our lab is actually to use computation to simplify microscopy, microanalysis, and biomedical imaging and cytometry type of applications, especially for point-of-care and resource-limited settings. And what you see on the slide are some of our technologies that literally convert a conventional existing cell phone into a microscope, as shown here. Or if you don't want to modify your cell phone, we're talking about devices that are extremely compact and cost-effective that could be powered through USB to conduct microscopic analysis. And this is the general theme, platform that we've been maturing in our lab over the last couple of years. And we refer to this technology as Lucas. And essentially, Lucas is the underlying platform that essentially led to a startup company, as I'll also briefly mention. So there are some key unique features of this platform that make it quite different than a conventional microscope, in the sense that, first of all, it's a lens-free technology. We use computational algorithms to make up for the lack of complexity, because there is not any lens or bulky optical components involved in these microscopes. As a result of that, they're quite compact, as you can see. This attachment to the cell phone is on the order of 40 grams. This standalone unit microscope or this one are both less than 100 grams. And that's why it becomes easy to put them together and carry around if you are a field worker, for instance, in a remote location. At the same time, these microscopes are high throughput, meaning that they can look at large volumes, large sample areas, which is quite important, especially if you're looking at rare disease signatures. While doing so, because the underlying technology here is based on partially coherent or incoherent holography, it's highly sensitive even for weakly scattering signatures like E. coli particles or other bacteria or pathogens. And the final thing is, these microscopes are tolerant to misalignment, as they should be, because the main application area is, again, field use and point-of-care offices, where you can't really expect a PhD student there. While telemedicine is one of the major areas of these technologies, there's also a need for extreme throughput imaging, especially for rare cell analysis, for circulating tumor cells, or maybe even for microarray research, where such computational tools are also going to be quite valuable and useful. As you can see, using non-conventional imaging architectures, as shown here, you can look at a very large area, both fluorescently and in a bright field modality, across 10-20 centimeters square, which is quite large compared to a conventional microscope. And again, it could be very useful for especially microfluidics and rare cell applications. I won't focus on this as much in my presentation. However, there is a startup company called Holomic, founded in 2011, received some initial funding, also an SBIR funding from NIH, which aims to essentially commercialize these computational imaging tools for research market as well as for point-of-care and telemedicine markets. You can learn more about the company at this address. Holomic stands for holographic microscopy, essentially. And I'll return back to Holomic and how it started from the university. Before that, I will focus more on the technology. So whether it's running on a cell phone or a standalone unit or a benchtop system, as shown here, these microscopes, these microanalysis tools, are actually working based on partially coherent illumination. So it's holographic in the sense that we are recording fringes that convert the phase information of the specimen into intensity oscillations. However, the source is not a laser, it's actually a light emitting diode. It could be sunlight as well. And what we do is we play with the geometry of this microscope so that we have partial coherence that's sufficient to record holograms of individual cells. And we can do this over a very large field of view that's actually unit magnification under unit magnification, directly scaling up with the active area of the sensor. So, for instance, this microscope has an active area of 24 millimeters square, which means you can do microscopy with 1 to 2 micron resolution across that large field of view, which is quite important. So with this platform, you can look at, of course, blood cells. These are some white blood cells. These are the lens-free holograms of these cells. You reconstruct their phase. Once you have the phase and amplitude, you can go back to any digital plane, any plane of interest, and then focus digitally to get back to the cell images. And these are some platelets. These are subcellular features of the white blood cells. Because it's a digital platform, you can do cytometric analysis and look at blood cells and their density, and use it as a cytometer in a sense. And these are some initial results which show actually that you can do less than 5% error rate for white blood cells and red blood cell analysis, and it's also going to be helpful for estimating the density or the volume of these cells in femtoliters based on their phase images. So it gives you quantified information regarding the cell volume, cell count, which is quite important, especially for blood analysis. And that's where actually the NIH SBIR funding is coming from. And you can do hemoglobin measurements as well based on a transmission geometry. So microscopy and cytometry makes this platform, even though it's fairly compact and cost-effective, rather powerful for especially some simple tests. And you can bring in more functions by microfluidic components that have surface chemistry on them, which means using a simple microfluidic device which has some, in this case, antibodies coated. These are actually some anti-CD4 antibodies. This was for monitoring of HIV-positive patients, so the idea was to coat the inner surface of this microfluidic device with some anti-CD4 antibodies so that from whole blood you can specifically focus to a subpopulation of white blood cells. Microscopy can't help you there because a CD4 lymphocyte or a CD8 lymphocyte, they look very similar and you can't really differentiate them. The only way is to label them or use a microfluidic device as such, which will selectively capture these, and then you can image using these field portable lens-free microscopes, and that's what you see here. And we have some nice results with this platform for HIV-positive patients, and these are actually some microfluidic devices that have captured the CD4 and CD8 lymphocytes from HIV-positive patients to understand the ratio of these cells. And when HIV kicks in, actually they deplete the number of CD4s, and that's when you understand you should start the therapy. So it could be used for more advanced functions, for point-of-care monitoring, or even for home use. So what I've shown you so far was actually a basic module which used a single light-emitting diode here, and the cells were inserted from the so that you can get a very compact microscope which can look at a very large field of view. So to give you some numbers, the imaging area is around 24 millimeters square, and the numerical aperture is around 0.15, which gives you a sufficient resolution around 1.5 to look at subcellular features of white blood cells and other parasites. Now I'll switch gears a little bit and then tell you how we can actually, without changing the compactness of the device, go to a higher resolution, also without sacrificing the field of view advantage. So instead of using a single light-emitting diode, we've put here some 20 of them. At a given time, only one of them is illuminated, is on. So there's a very inexpensive microcontroller here, which essentially turns on these LEDs one by one. And you insert your specimen, which might be a blood smear in this case, for instance, and then you record the lens-free diffraction holograms. What we do is, as a function of time, actually, you just switch on these LEDs one by one, and then the light field or the holographic pattern actually starts to shift. And then you can synthesize a super result, pixel super result image, which now contains much smaller pixel size, which now can resolve much smaller features, oscillations of these holograms to increase the numerical aperture, to increase resolution, without sacrificing the field of view. So that's actually shown here, where with a pixel super result lens-free microscope, we can now see much higher fringes, which translate into actually a higher resolution, deeply submicron. In this case, actually around 0.6, but recently even less than that. And of course, while we are doing that, we don't sacrifice the field of view. So for instance, this is a scale bar of a millimeter. You're looking at 24 millimeters square. And if you're digitally zoom into different parts of this image, you'd be seeing these monolayer of blood cells. This is actually a granulocyte, and it has some nuclear features inside, and these are red blood cell clusters, so that you get a very large field of view with a distant submicron resolution. Also, that comes within a very compact, like less than 100 gram installment. This is good for, again, for any pathology purposes. These are some malaria parasites that are imaged using our lens-free microscope as shown here, and the signature of the parasite is shown here with the red. And this is a conventional microscope, except conventional microscope would be looking a tiny circle here to see these parasite signatures, but most parasite signatures are rare. In the case of malaria, it's only around 1%. So to be statistically significant, to say it's a negative slide, you got to screen a large area by scanning the field of view of the microscope. But using a field portable lens-free microscope as shown here, you can capture a significantly larger area and do automated searching of these things without any manual scanning. That's major advantages here. And this is actually a pap smear used for early diagnosis of cervical cancer. And in this case, the field of view is around 30 millimeters square. So the field of view scales with the sensor. So that's kind of a unique feature of lens-free computational imaging. It can follow the Moore's law qualitatively in the sense that next generation sensors, which would be 15 megapixel, 20 megapixel, would not trade off anything in our design. And it's going to enlarge the field of view without touching or without degrading the resolution. And sometimes it's going to improve the field of view and resolution at the same time, depending on the design of the CMOS imager. And that's where then you can really follow with your microscope without changing your construction a trend which improves the field of view and resolution at the same time. And we've shown that you can do actually more interesting stuff. You can do instead of a single projection image where we capture the transmission microscopic features of a sample, you can do very similar to X-ray computed tomography, where you take a light source and rotate it, and then at each point here you slightly jitter the light source so that you synthesize a super result holographic image, and then this way you can synthesize a tomogram of the animal or the cells. And that's what lens-free tomographic microscopy refers to in our case. And you can put this on actually on a field portable device as shown here, which has several LEDs at different angles. A static sample comes in, and then you can do tomographic reconstruction based on these partially coherent super result projection at different angles. So what I've shown you so far were mostly transmission microscopic images acquired with these partially coherent sources, but you can also do fluorescent microscopy on a cell phone. And this one actually is a fluorescent microscope which looks at a very large area installed at the back of a cell phone camera unit. It's a very compact unit on the order of a matchbox with less than 30 grams. And this is a flow cytometer in the sense that it can look at specimen while they're flowing and then understand the density of the white blood cells or other things. So in this case, we're looking actually a white blood cell density measurement using one of these attachments to the cell phone, where if you just integrate a movie captured by the cell phone, you can estimate the density of the white blood cell, which nicely matches to a conventional culture counter hematology analyzer for the same patient. And using, again, surface chemistry tricks, you can convert the same platform into something more specific, specific for certain pathogens. In this case, we looked at some microcapillaries that had surface chemistry on them for specifically capturing E. coli particles, which were then conjugated with some quantum dots so that the entire thing was essentially emitting red once the E. coli infected or contaminated sample was flushed through. And we've determined the detection limits using some tests on skim milk and water, and the results turned out to be around 5 to 10 colony-forming units per milliliter, which is quite good for considering the compact and field-portable nature of these devices. So, and recently we've introduced actually some other technologies that also benefit from the computational power and the connectivity of the cell phone. And in this case, we're looking at actually a digital reader for different rapid diagnostic tests. So rapid diagnostic tests, you can have literally several hundred different types of tests, whether it's an HIV test or sexually transmitted diseases or malaria or even TB. So we've created a platform which essentially can read any rapid diagnostic test universally using an attachment to the cell phone, and there's an application at the cell phone which essentially captures this image. It could be a fluorescent, a rapid diagnostic test, or simply reflection or transmission, and then we quickly quantify it and then understand if the test is valid or if it's valid or not, and then of course, we can quantify whether it's positive or negative. And then once you understand this on the cell phone, you can transmit that image to a Google Maps interface so that you can understand spatially and temporally what's going on at different parts of the world for different diseases that you can monitor through rapid diagnostic tests. So this is also a very nice platform which would help us bring more advanced tools to remote locations where cell phones still work. And this is the Google Maps secure server, which you can pull up different rapid diagnostic tests and look at the world map. Most of the tests were done at UCLA. That's why you see that single dot here, which is essentially locating UCLA. As I was mentioning in the introduction, this platform, most of these technologies are filed through UCLA's Office of Intellectual Property office, and they're now licensed to Holomic, which is based in Los Angeles, and it's received some initial funding. But the model that we used to transfer this technology from UCLA School of Engineering to actually a startup was something that is quite unique in the sense that the School of Engineering 3 years ago started an institute within the school which is called Institute of Technology Advancement, ITA. If you type ITA UCLA, you can find more information on that. The main function of that institute was to bring in people who had some background on startups, on businesses, on campus part-time, and interact with faculty to understand which technologies were maturing and would have some potential of commercialization. So as part of this institute, I had the opportunity to work with an individual who was working with us and understanding the technology better and then its opportunities. Now the same person has left UCLA because of conflict of interest and now is leading the company for commercialization of these technologies. And again, we have an NIH SBIR. In addition to that, we have some private funding to actually explore different commercialization opportunities of these computational microscopes, including male fertility tests, CBC, complete blood count, as well as some water quality monitoring applications, especially for even the home use, because just in the United States we have around 40 million houses with their own wells, so there is potentially an interest even at the home to use these microscopes attached to the cell phone to do water quality monitoring. So with this, I'd like to conclude and acknowledge our funding agencies at UCLA that funded my group and led to this development. Thank you.